access to vaccine has thankfully been overcome. There is plenty of vaccine in North Carolina at this point in time for us to be able to get to patients who want it. Your point is a great one, that now we have to do a little better job of convincing people that this vaccine is safe and effective. The health department and Wake Forest and Novant are really used to this conversation because we give lots of other vaccines that make people nervous as well. So we're really committed to getting out into the community to dispel any myths that are out there about concerns about safety, and to encourage people to come to talk to their regular doctor, to come to talk to one of us at our vaccine sites to be able to help with a comfort level with the vaccine.
We will continue, all of us will be offering vaccine, and people will come to a point at which there will be some folks that never accept the vaccine. There will be others that will come at different stages. Maybe now, it could be 3-4 weeks from now, but we will continue to offer those vaccines, maybe in different ways. We don't know that we'll continue to do large Saturday events, in the coming months. It may be that it's in a different format that we're offering it. We're hearing about possibly moving them into even pharmacies as well, and trying to get into the private physician offices out in the rural areas. So those things, so there may be different ways that it'll be offered, and folks have to come to it at their stage. I am concerned, Haley, that as we have with what happened yesterday, it in our world of social media, the news, everything, that it can get blown up to where we create more anxiety. And so that's the part where we will continue to have to offer and work with folks to try to help allay those fears, and making sure that everyone knows whenever you're getting a vaccine, any office that's given a vaccine, any event that's giving a vaccine, we have thought through with our EMS partners, we have emergency management folks, we have event planners, that to make sure that it is as safe as we can make it and we can get the care people need. Should a rare event happen. The urgent today, the message is for the folks who are scheduled tomorrow, both at the Sears complex with Novant and at the combined event over at the fairgrounds, to assure folks that we have safety measures in place. We will be working with you. If you follow what Josh said with drinking some water, don't fast. This is not the time to fast. Go ahead and eat something. That we will safely get you the vaccine tomorrow. That none of us is going to do anything that we believe or felt that was jeopardizing patient safety ever. No one is going to do that. So that's the message for folks for today and tomorrow. And then it's the broader message, that these vaccines are safe. Can we guarantee that someone would not pass out, or you're not going to get a fever, or you're not going to be muscle achy or those things? No. But all of us have seen, Joshua has seen the stats. I do inpatient medicine. I've taken care of folks from a 5-month-old to a 99-year-old 1 week on my inpatient service that were admitted because they had gotten COVID. There was no other reason that they got admitted. So it's always that we in the medical profession sometimes forget that a lot of our folks out in town don't see what we see on a day in, day out basis in our office. So that's where I'm very compassionate to folks. I understand the hesitancy, but we want to let them know that we believe what we're doing is safe and effective.